Deputy Director for Health Services, Dr. Lucina Koyo, has admitted that the hospital has no cold room or mortuary to hold dead bodies. We'll be getting more on that report very shortly, even as our Jackie Maribe now joins us. She is standing by for us live from the Pumwani hospital. Jackie, it is a discovery that has shocked the entire nation. What more can you tell us about the ongoings at Pumwani after the Nairobi governor's action?
Unnerving, really, and the events unfolding here at the Pumwani Maternity Hospital today. But what's even more unnerving is that we're learning that this is not entirely new to the hospital, or in fact other facilities around the country. And by that very admission, and that you have just mentioned, Pumwani Maternity Hospital does not have a cold room. They're saying that they have a holding room where in the event that there are deaths, whether of neonates or of these mothers, that they are stored in a holding room. And before, these bodies used to be transferred to the city mortuary every other day, but now it only happens on Mondays, Wednesdays and Fridays. And the official position of Pumwani Hospital as at now is that they had 11 neonates, of course fatal, and out of these mortalities, and 4 were meant to be transported to the city mortuary on Friday. That did not happen. Sources here in the hospital telling us that this is because they have been having issues with ambulances here in the hospital, a matter that was earlier raised by some of the nurses that spoke to Governor Mike Mbuvi Sonko. 6 other mortalities that they had over the weekend were meant to be transported to the city mortuary today, being Monday. That had not happened by the time the governor was making his way here to the hospital, and there was 1 other neonate that had not been tagged. As you had mentioned, Dr. Koyo earlier spoke to us, and this is what she had to say in her admission that they don't have a cold room in the hospital.
5 of the bodies were here on Friday, but there was a lapse in taking them to the mortuary. And now the 6 bodies that are here were here in the morning, were bodies that have accumulated since Friday up to this morning. But we have resolved that, and they have been taken to the morgue. We don't have a mortuary, that is why we have a holding room. Yeah, meaning we hold the bodies there, ready to be transported to the mortuary. We have been transporting the bodies on Mondays, Wednesdays and Fridays, and now we've taken corrective measures. We shall be transporting the bodies to the morgue every day.
Now, and the medical superintendent of Pumwani Maternity Hospital, Dr. Catherine Mutinda, has been suspended while away in Zambia. She is attending a conference on neonatology, as well as other officials, Zadok Angaya, George Dimo, who are administrators at this hospital, and Dr. James Kamau, an obstetrician gynecologist, who was actually meant to be on call today but was not. And from some of the videos that we were able to see, when the governor made an impromptu visit here, he was being looked for, he was not available. And these are just some of the concerns that patients who have spoken to us on grounds of anonymity say that they have been facing here at the hospital. Sometimes they come in their numbers and they're not being attended to on time. But the hospital staff as well are saying that they are understaffed and they have been having issues with some of their equipment. And one that had been raised today is the autoclave machine, that is what they're calling the CSSB. This is a sterilizing machines that are said to not have been working. They have been breaking down, and the hospital says they have been liaising with the Kenyatta National Hospital and Mama Lucy Hospital. And unimportant to note why these machines are an important factor in this particular case is because some of the highest cases of infant mortalities that are reported, always come from, of course, infections, and that's the #2 cause of such mortalities. And this is how these machines are coming in. But to continue to keep an eye on events here, our sources from within the hospital are telling us that currently, even as investigation is ongoing, some of the hospital staff are recording statements already, and we are expecting that these 11, or rather 12 neonates that were discovered here in the hospital will be transported out of Pumwani Hospital to the city mortuary today. So we continue to keep an eye out for that, and we'll give you an update as soon as that happens from Pumwani Maternity Hospital.
Jackie Maribe, thank you reporting for us tonight.